Is it streaming already?
I asked the,
Hmm. It's about just your overall well-being. And we do this maybe about 2 to 3 times a year. Because everybody can't make it at that time. And people still have questions. You can always do a one-on-one. That's never an issue. But it is about getting you the information. Okay, I think we can probably, I'm gonna keep you all out late. Okay, so this series is about, I thought it was cute because it's March Madness for people who like basketball. So we just named it Menopausal March Madness. Because for some people, it feels like you are going insane and you don't feel like yourself. You're tired all the time. Moods are a little quick to come. The fogginess is there. No libido. There's a whole lot of things that go into it. But just to start off, there is premenopause, there is menopause, there is postmenopause. And what's the difference? Here's the difference. Menopause is really strictly a point where your hormone levels have dropped to a point that you are no longer having your cycle. Doesn't mean that you don't have any more hormones at all. They're just too low that you're having a regular menstrual cycle. People who have undergone hysterectomy, their hormone levels will drop as well. If you remove your ovaries automatically when you're doing surgery, you're going to go into a surgical menopause. So it is really just the number where your hormone levels are falling is what considers you menopause. Now, people will start going through premenopause as early as late 30s, early 40s. Your testosterone levels will start to drop. So women and men both produce testosterone and estrogen. It's not that men only produce testosterone and women only produce estrogen. We produce both of them. We produce them in different amounts. So men are going to have a much higher level of testosterone and women will have a much higher level of estrogen. So when that starts to happen and those hormone levels start to drop. So for women, our hormone levels, estrogen, and especially testosterone, will start to drop in our late 30s, early 40s. And it is about a 10% drop every couple of years. So by the time you're 50, your testosterone level might be 5 or less. And when it gets to that point, symptoms that people will start to experience. They'll start to have, they can't sleep at night. They have hot flash at night. Their joints hurt. They're tired. They don't have a libido. The mental fogginess. They can't remember why they walked into rooms. That was my issue. And so being a physician, when I'm talking to people and I can't come up with words, it started to get a little frustrated. And my grandmother actually went through Alzheimer's. So I'm like, is what's happening to me? But my story is that they've actually just done studies on Alzheimer's and menopause. And so women who continue on hormones after going through menopause have a significantly lower risk of developing Alzheimer's. And they've done studies on it. So it's not just you're going crazy. It's a hormonal thing. And that's for men and women. People focus on women with menopause, but men go through a very similar issue. Their testosterone levels will drop to a level where you'll see they have a bigger abdomen. It's a harder abdomen. They're tired. They don't want to do the things they used to do. They start to have erectile dysfunction. These aren't just things that happen to women, it happens to men too. And it is a hormonal change. So what I tell people as far as men are concerned is that when men and their levels drop below certain numbers, their risk for heart disease is significantly higher. They've also done studies for men who their levels are really low, who have prostate cancer. And those who have normal levels actually have less chance of developing prostate. So it's things that people don't know that is actually an issue. It's not just about the libido, because when people talk about, well, you just want that for it, it's not just about libido. It is about your mental health and how you feel. So if you're tired all the time, you're not going to work out. Testosterone helps with muscle mass. So when you start to lose muscle mass, all of those things can, I mean, it's a ripple effect. So it is a health issue. For men, a lot of the insurance companies will pay for them to get testosterone. They pay for them to get medication for erectile dysfunction. For women, they only cover estrogen. But when you're getting estrogen replacement, and I write prescriptions, I do bioidentical hormones, I do regular hormones, we do alternatives that's not hormones. It's whatever symptoms that you're having that need to be addressed, and we try to address it. But for women, people don't really associate testosterone with women. But when women replenish their testosterone, you feel like a whole new person. You feel like how you used to feel when you were in your 20s and your 30s. And so, get older doesn't mean that we have to just give up. So this is just things that we want to make sure people are aware of. Yes, when your hormone levels change, do you have symptoms? Most people do. For some people, it's not an issue. And if it's not an issue for you, it's okay. You don't have to do these things. There are benefits to it. But if you're having issues, then there are options. Okay, so that's just kind of like the icebreaker to get all that out of the way. We are not mad, we are not crazy, we just have some hormonal changes that can be fixed. But first, I'll start with anybody with questions, and then we'll kind of go into just kind of, because I'm big on just overall health, not just addressing one thing, but addressing your overall health. So any questions before we kind of move on?
I have a question.
Yes, ma'am.
How do you identify premenopause?
So menopause, the definition, the true definition is you don't have a cycle for 12 months. And once you haven't had a cycle for 12 months and your hormone levels have dropped below a certain level, that's the period after that is considered postmenopause. Because people will ask me, well, how long do these symptoms last? Everybody says. I've had some people who haven't had one hot flash, and then I have some people, so her, she has not had a hot flash. Bless her soul. Most of us have, and it's not pleasant. I saw this TikTok. I don't know if anybody has seen this TikTok video. She's a bald lady.
Yes.
Okay. So, yes. And the steam is coming off of her head. And so I've had people who have been in meetings and their clothes are drenched. And so it's embarrassing, number one. It's uncomfortable. And nobody wants to live. And so there are different things that can be done. But like I said, so menopause is no cycle for 12 months. Your hormone levels, normally, if we're doing a blood test, FSH is the test that we usually will check to see whether or not you're menopausal. Sometimes that level can fluctuate a little bit, but if you're over 25, if that level is over 25, 30, you are considered menopausal. Some people will go into premature menopause. That's usually before the age of 40. Doesn't happen a lot, but there are some people who have gone into premature menopause. For women, when you're in menopause, and people who come to see me, they know I always ask about your vitamin D, taking your vitamin D. The reason I ask you that is because, especially after menopause, you're not producing estrogen. Estrogen protects your heart, it protects your joints, it protects a whole lot of other things. But when you go through menopause, your risk for bone density starts to decrease, falls, and fractures. An older population is the biggest issue that they have that leads to death. So we try to keep our bones together. And vitamin D is something that I always encourage people to do because it will help with maintaining your bones strength. That's affected in menopause. So we're trying to make sure overall that you we're going into this new phase of our life, feeling better, looking better, and enjoying this second half of life. So that's technically the definition of menopause. So if hormone levels above 25-30, you haven't had a cycle in 12 months, you're technically menopause.
So, as you know, I've been on pellets for, what, 3+ years?
Yeah.
And I was thinking the other day, how long is this going to be going on? Is there a point where we don't need them?
Everybody is different. So one of the things I always focus on is nutrition, exercise, your mental health, you got to manage the stress. All those things are factors as we age. And as those things get worse, if your diet is bad, you might need some help with hormones for a long time. So there are certain things I tell people to look out for, like decreasing the carbs and sugar, because it's inflammatory. Making sure you drink your water, because if you're not getting 64 ounces of water a day, your cells are dehydrated. They don't work as well. Doing the vitamin D, doing your B12, doing just routine maintenance of those things. Some people don't need it. Everybody isn't on hormones. People who probably live in Hawaii, their stress level is different. They eat different. And so all of those things can be factors. So I tell people looking at this as a whole, not just taking the hormones, but doing other things to help as well. Doing light weights to improve your muscle mass. So fitness is also a key to all this. The more active you are, it helps your joints, it helps your bones. So all of those things as a whole is meant to actually help you transition in a better way.
Yes, I was piggyback off of the first question. If an individual is on an IUD, are there any other signs besides the absence of a period? Because, with that, it can.
Some people will start to have hot flashes. So a lot of the symptoms can be hot flashes, vaginal dryness, low libido, mood, not sleeping, joint pain, skin changes. All of those things go along with those drops in your hormones.
And that may prompt the physician to
Mhm.
test.
The average age in the United States for menopause is 51, 52. That's the average. Some people will start a little earlier. Some people will go through it a little later. I've had people who are 55, 56 who went through menopause. I've had some people, like I said, as early as 40 who have gone through menopause. So everybody can be a little different. And once again, everyone's symptoms are not the same. So it just really depends on what's bothering you. And I had one of my patients said, I didn't even know I had those symptoms until I actually got the pellets. And it was like, but some things you just live with, and so this is just what it's supposed to be. And what I always tell people, our parents 50, 60 is not the same as what it is for us. We're much more active. A lot of people are starting later in life with having kids. And so it's different for us. So it's maintaining that complete healthy life. And once again, I'm big on nutrition. We have to just make sure that we know what we're putting in our bodies, we know what we're eating. You gotta sleep. And I know menopause has an issue. A lot of people have, that's one of the bigger issues, is not being able to sleep. So it is able to address those things. And so we can address all those individually and tell you what you can do for those different things, even if it's not, we're not doing pellets. So let's start with sleep. So what can we do to help the sleep? Yes, I've talked about testosterone will actually help people be able to sleep better. But there's also magnesium glycinate that you can actually get from a health food store. It helps you with sleeping. There's also, some people will use melatonin. It helps some people, for a lot of people, it is not enough to help them stay asleep. there's CBD. And so CBD doesn't have to have the THC, which is the marijuana part of it. Doesn't get you high, it just helps you with those symptoms. So that's CBD. There are ashwagandha. Ashwagandha helps with relaxation, that may help a lot of other people sleep. So there's a lot of different things we can do other than hormones. If you don't want to be on hormones to help you sleep. Okay. What's the next thing? Vaginal dryness. So estrogen works in the vagina, it works in the breast, it works on the skin, and it will help you with vaginal dryness. I still write prescriptions for people who want to be on estrogen. There's nothing wrong with estrogen. There's been this big fear that got put out in the universe about estrogen causing cancer. That study was not, the result of that study is not what people thought it was. So it wasn't, so there were different populations. So there were women who had already undergone a hysterectomy and they only took estrogen. And then there was another group that still had their uterus. And anytime you're on estrogen, if you have your uterus, you have to make sure someone is giving you progesterone. You have to have a balance with that. Otherwise, the lining of the uterus will become abnormal, and it could possibly lead to abnormal cells and possible uterine cancer. So you don't want to take unopposed estrogen if you still have your uterus. So that's an aside. But getting back, the big thing with estrogen is that it was the patients who were taking synthetic progesterone with estrogen that had a higher risk of breast cancer. It was not the estrogen patients alone. They did not have an increased risk for breast cancer. So I know a lot of people got afraid of estrogen and all that came out, and people will still say, you take estrogen, you're going to get breast. That's not what the studies show at all. So there are even people who, and I'm not advocating, you got to talk to your oncologist, women who have breast cancer. And if someone has had breast cancer, they usually test for hormones to see if it's sensitive to certain hormones. I'm not suggesting that you go out and start hormones if you've had breast cancer, but they have done studies with testosterone with those patients who have had breast cancer, but all their hormone receptors are negative. So women who have negative hormone receptors, they've had breast cancer. It is not 100% complete contraindication for them to have testosterone. They can't do estrogen. Nobody's going to put them on estrogen, but they possibly can do testosterone, which helps for a lot of people with most of the symptoms that they're going to experience. So the vaginal dryness. I will do vaginal tablets that are estrogen. You can do vaginal lubrication. So when you're actually involved in having intercourse, a lubrication is going to help that moment. There are vaginal moisturizers that are a little different. You have to use those 2 or 3 times a week, minimum, and that actually helps bring moisture back into the vagina. So when you're sexually active, it's not dry, it's not painful. There are vaginal estrogen inserts, there's tablets, there's creams, there are estrogen patches, there are estrogen rings that you can insert to the vagina. All those things are going to have the benefit of helping you alleviate the hot flashes, especially if they're in the daytime, but also help with the vaginal dryness. People do vaginal rejuvenation. So vaginal rejuvenation has no hormones at all. It is a procedure. There is a laser vaginal rejuvenation, there's radio frequency, there are multiple types of vaginal rejuvenation procedures. It is meant to actually improve the tissue in the vagina. So it helps with the elasticity, it helps with dryness, it helps with, so people who have breast cancer and they can't take hormones, but they want to be sexually active, but it's painful. So those are different things that they can do to rejuvenate the tissue. It does increase orgasms. It does have bladder issues because the bladder sits right on top of the vagina. So those are other things that you can do for those symptoms. What are some of the other big symptoms that people have? The weight changes. So, the big one for most people. different for most people. So I always tell people that I started off with your nutrition and what you eat matters. If you're doing a lot so with weight, alcohol is a lot of sugar. And I know we all hang out, and that's fine. But if you're doing a lot of wine, if you're doing a lot of mixed drinks, it's a lot of sugar. And so once we go through those changes, your metabolism changes. So we have to redo this whole thing, cut back on the carbs, so bread, pasta, rice, cut back on the sugar, fried foods. I'm not saying you can't have it. I mean, it's life, but it's just watching and cutting back on that. A lot of people, their symptoms will improve significantly, just doing a lot of those things. Protein, we have to make sure we're getting enough protein. When your hormone levels drop, testosterone drop, your muscle mass changes. If you're not getting enough protein, you're going to have, the skin is going to change. It won't be as elastic, it'll be loose. We're trying to maintain the muscle mass. So increasing your protein intake is another thing that I tell people to do. Weight changes. So what you eat matters. I said the protein is going to be a big thing. I'm not a big fan of keto, but I do think people should decrease a lot of the carbs they're actually eating. The fitness is going to be about 20% of weight changes. Your diet is the other 80. So we've got to make some changes in how we're eating and when we're eating. So if you're eating your biggest meal at night, you're going to sleep. So you're not working off any of that energy. Testosterone and estrogen do help with weight changes. I'm not suggesting that if you get on hormones, you're going to lose 30 pounds. I'm not saying that. But it will help you with managing your weight. Taking vitamin D helps you with your weight. Taking B12 helps you with your weight. So those are things that I often suggest to people to make sure you're getting those supplements. Foggy memory. That was probably one of the biggest reasons why I got it. Because I could not remember certain words. I'd walk into rooms, couldn't remember why I walked in there, and I got tired of going back and forth to figure out why I walked into that room. So the mental fogginess. There's Menopausal, reading, doing crossword puzzles. You have to keep your mind really active. And that helps a lot of people with the mental fogginess. The testosterone does help with mental fogginess. What are some of the other things that you guys talk?
For me, our conversation.
Okay.
I noticed the difference from before to now.
Mm-hmm. One of the other things that I tell people, so heart disease is much higher after menopause. And the reason is because of the change in the hormones. It's a big deal. So if you have been on hormones and you're taking an oral hormone, you should not suddenly come off of it. You have to wean yourself off. Because if you suddenly come off of it, your body, especially heart cells, notice that drastic change and your rate for heart disease is significantly higher. So if you are going to stop it, you gradually stop it. Don't just stop it. Okay? But anxiety, depression, heart changes, all of those things are a part of hormonal changes. And it's not talked about a whole lot, but those are things that will actually affect you. I've had people who were not even menopausal, but they were having significant anxiety. And I know we are not opposed to any anti-anxiety medication, antidepressant, because some people actually need it. I don't think it should be our first choice. And if there are things that we can do to help those things, anyone who comes to see me, I will ask you about your mental health because it is a part of your total health. And if you don't take care of your mental health, the other stuff is going to go by the wayside. So I encourage people, if you don't have a therapist, I think you probably all need a therapist at some point in our lives. But if you don't have one, I strongly suggest if you're going through different things, don't just be like, it'll be okay, because one day it'll get to the point where it's not okay anymore. And so focus on your mental health. But yes, the heart palpitations, that is something that a lot of people experience, and then when they're back in balance with their hormones, it goes away. I'm not suggesting you stop taking your heart medications. What I'm saying is that those things that we're experiencing, everything isn't contributed to hormones, but a lot of it can be. And so what I suggest to people is go get your levels checked. Even if you decide not to do anything about it, at least you know where you are. That's the same thing I'll tell men. Go get your levels checked. Because men are a little bit more reluctant than women to go to the doctor. And so heart disease is a real issue. And people are dropping dead like we haven't seen before. And we're in that age group where it starts. So I encourage people, get your routine exams, of course, your regular health screenings, but have them check your hormone levels, because unless you ask, they're not going to do it. And most people, when you ask for hormone levels, are they're not checking testosterone. Because remember, most people don't associate testosterone with women. They only associate it with men. But women produce testosterone as well. And when those levels drop, you will feel it. You will feel the changes.
Can you talk about, or have you heard about how cholesterol is affected our menopause as well? Because I know so many women who nothing has changed, but they're in menopause now.
So it affects. So testosterone, believe it or not, is the most abundant hormone in men and women. Because the receptors for testosterone are on every cell in your body. So it affects a lot of different things. Even estrogen, testosterone is more abundant than estrogen. So cholesterol can be affected when your hormone levels change. And once again, you don't metabolize the same. And so that's why, I'm constantly telling people, make sure you know what's in the food that you're eating. Because we don't do as much fiber as what we need to do. And when we have low fiber, fiber actually binds cholesterol. So if you're eating enough fiber, whether you're adding a supplement or whether or not you're getting it directly through your food, the more fiber you have, fiber doesn't stay in your body. It gets excreted. So it binds the cholesterol to kind of move that out. So there's a number of reasons why. But like I said, just managing and changing a lot with your diet can affect it. And some people are just more genetically prone to cholesterol. It just runs in the family, and you just have to be on that medication. But I do encourage people to actually increase their fiber intake. We don't do enough fiber, we don't do enough protein, we don't do our water. Those things are going to make a difference, especially as we start to be
What are your thoughts about cortisol management? Cortisol,
Cor-
like, then supplements or things.
So, what I tell people, stress actually increases cortisol levels. Cortisol is a storage hormone. And so if you're not sleeping, and we're at an age where we have kids that are either teenagers or in the 20s, our parents are older, we're making changes in our careers and jobs, you're not sleeping, so the stress level goes way up. And so I try to make sure that people have their cortisol levels in check. So I will sometimes, if they're still having a problem with weight loss, I'll check the cortisol levels. Because if it's high all the time, your body is in storage mode. And so it is a factor with people losing weight. And some of the hormones those levels. Questions?
Does having PCOS affect how menopause can affect you?
So PCOS in general is an imbalance. And so a lot of times with those patients, they have a much higher level of testosterone compared to the estrogen. And what starts to happen is that weight can be a factor, hair growing in places that they're not used to, increased risk for diabetes is another thing that goes with PCOS. And so with PCOS patients, once, whether they're in menopause or not, once you go through menopause, all those hormone levels start to drop. And so, yes, can you have, is it different as far as menopausal changes? Not very much.
And then so if the hormone levels decrease, that
For PCOS patients?
yeah.
So a lot of times their symptoms are, like I said, the changes in like hair growth. They don't have regular cycles. The weight is a factor for some of them. It's harder for them to lose weight. They are insulin resistant, so they don't process the foods the same, especially carbs. And so once their hormone levels have gone down to menopausal levels, the same things that will be happening to everyone else is going to happen to patients too. You were looking for some. So it doesn't get better.
But you know what's like, I don't have as much of the hair like I did before. Actually lost weight. So that's weird. But what happens with me is I'll have these weeks where I just sleep at night because I'm sweat, I'm hot, I'm like trying to live in the refrigerator. Then I'll have a set of weeks where I'm under a heavy comforter and a blanket shivering. There has to be some no, what's turkey now? No, what is and the next day I'm like, oh, we're gonna eat down yeah.
And it can be very frustrating. And so a lot of it is the hormones are, they're imbalanced. And so it's trying to put you back in some type of balance. With PCOS, the hormones are also imbalanced, but they're imbalanced in a different way. And so there's even like certain supplements. I tell people there's something called black cocoa that may help with some of the hot flashes. There is another supplement that you can get at any of the regular stores. It's called amberine. It helps with some of the menopausal symptoms. So everything doesn't have to be, because everybody doesn't want to be on hormones, and that's okay. So there are other things that we suggest to people to try to help them go through this period in their life, not miserable. And so that is really the biggest.
And then
You can ask more.
is there, like, some people say that soy affects hormones.
So here's the thing with soy. If you are doing pure soy, the problem with a lot of the soy is that it's so over-processed that you're not getting a whole lot of soy. And so if you're gonna do soy, you want to make sure that you're getting a product that is not as
Well, I don't, well, the reason why I asked is because I'm vegan.
Mm-hmm. Yeah.
Taste from out all the time. They're like, oh, it has nothing to do with that.
Well, soy stimulates estrogen. And I'll tell people, when you're doing over-the-counter supplements, you don't want to do a bunch of different ones. They're added. So if you're doing soy, you're doing glycogen, you're doing some other things that actually, those all stimulate estrogen production. So you don't want to do things that are going to be stimulating, over-stimulating you with certain hormones, especially with estrogen.
For asking a question, could you repeat the question? Although like,
I mean, I'll do it going forward, because
yes.
I'm gonna do it.
Okay.
Come on in. It's okay. Any other questions in the back? If people didn't have hands, the king and lady have questions about, you okay? We're gonna put you right in the front.
All of them.
I'm just joking. You can sit wherever you want. So, what is the process for all this? If you think you are interested in doing hormones, or you're unsure, or you just want to know what your levels are, what I tell people to get is a total testosterone, and we have information for it. So we have people do total testosterone, free testosterone, and estrogen. If you haven't had screening labs with your primary care doctor, I also check some other labs like CBC, your thyroid, because thyroid plays a role in your hormones. They're all kind of intertwined. But those are the main ones, the FSH, and estrogen. Those are the ones that I usually have people check. For someone who has not been on pills and they haven't had their cholesterol checked, I will have them check their cholesterol as well. Because sometimes for some patients who are on pellets, sometimes with testosterone, it might increase your cholesterol a little bit. So I usually start with a baseline, so we know where you're starting and how that function is. I'm more conservative because if you're doing pellets, so for women, we recommend either creams or pellets. With the creams, you have to do them every day. If you don't apply it every day, and I would probably say maybe 20% of my patients who are doing hormones will do the creams. If you don't apply it every day, the hormone levels drop back down. When you have pellets for women, I can't give you a lot of testosterone at one time, because if I do, you will have side effects. You will have hair growing where you don't want it to grow. You can sometimes have thinning hair. You can have enlarged clitoris. You can. I'm more conservative because I can always add. No one, when they put pellets in, you cannot take them out. They will dissolve. They're made out of natural products. They're made out of yams. So they dissolve over a period of time. So you just got to deal with it for that period of time that you have pellets in. So everybody's not the same. I'm just more conservative because I know I can't do anything about it. Once it's in there, but I can always add if I need to. Okay. So I have people get their labs, but creams and pellets is what I use for women. For men, they usually will do injections, or they'll do pellets. They can do trophies, which are things they put under their tongue. So they can do those things. With women, we do pellets every 3 to 4 months. With men, they do it every 6 months, because I can give them a lot more at one time. What else? Oh, so once you get your labs back, then we kind of address where you are and what you need. Once again, I would probably say maybe 60 to 70% of my patients are only on testosterone. The other 30 who are getting pellets will usually do estrogen as well. But there's nothing wrong with a prescription estrogen. You just have to remember that if you are getting estrogen, you have to make sure you are on progesterone if you have a uterus. If your libido is really low, the estrogen may help with some of the dryness. It may help you some. But once again, it just depends on what your symptoms are. And we have a question that we ask you about different symptoms and how you feel before you get them, and then we have you come back after you have them and see where you are.
Did you say that insurance does not cover this for women, but it does for men?
So we stopped billing insurance for pellets because it was all over the place. Some of them would pay for it, some of them would pay, but they would pay you $30. Some of them, so that's why we stopped doing it. But if you want to send it to your insurance, we will give you an invoice that has like the diagnosis codes, what you paid for it, and what the procedure was. And some of the insurances will reimburse you some of it. They're all very different. So that's why we stopped. We used to, but then it just became outrageous.
Do you file insurance for men?
Do we file it? No, but we will give you the invoice and you can actually send it in.
For men too.
For men too. Yeah, for anyone who has any of those, and a lot of people will use their health savings account. So it's a medical issue. So you can use those funds for pellets or whatever you want to do that is medically related. And it is, those funds are tax, it's pre-tax. So you do it with your job and you can use those for that as well. We generally charge 400 for women, and we charge 800 for men. It ends up being about the same because women come every 3 months, they come every 6. So the price is really the same. It's just that we can extend it for men to come every 6 months and give them more at one time.
I got 2 questions online. The first question is, what are some of the side effects of hormone therapy?
So it depends on which hormone you're talking about. So if you're getting estrogen, you can sometimes, and it usually happens when you first start taking it, you may have some breast tenderness. That's not uncommon. You may have some irregular spotting when you first start taking hormones, especially if you're getting estrogen. With testosterone, some of the side effects can be what we just talked about. So acne, especially it's dose dependent. So the higher the dose, the higher the chances that you may be having some side effects. But enlarged clitoris, hair growth in places that you don't necessarily want them to be. The acne, sometimes there could be thinning hair, almost like male pattern baldness. Doesn't happen a whole lot. It just depends on what your dose is and how you're responding to it. But we will also, when we give people the pellets or the creams, there's also DIM, D-I-M, it's a supplement that you can take, or spironolactone. It helps prevent those side effects. We've even given spironolactone to people who they're not dealing with hormone replacement, but they're dealing with acne. And so we've given that to those patients as well. It helps with that as well. What's the other question?
Second question, what do you recommend for libido and vaginal dryness only? There are no other symptoms.
So there are prescription medications just for libido, but you do have to take the prescription every day. It is not, a lot of insurances don't cover it as a first tier. So the cost out of pocket may be a little higher, but there is a medication that you can take that may help your libido. What was it? Oh, vaginal dryness. So for non-hormonal, there is vaginal lubrication, there is vaginal moisturizers, there are vaginal rejuvenation procedures that are lasers, radio frequency. Those are things that will actually help you with vaginal dryness that are not hormones. Okay. Any other questions? Yes.
Yeah, you mentioned, so the Mona Lisa versus the palette.
So the Mona Lisa is going to treat the vaginal tissue. So that's one of the lasers that people use for vaginal rejuvenation. So it will help with, so how it works is it will cause new vascularity to form. It helps with nerve function. It does some tightening. So that's how the Mona Lisa, so there's about 7 different types of devices that people use. With the Mona Lisa, I'm pretty sure, I think you can't be sexually active for maybe 1 or 2 days, because it's a laser. Um, but it does work. Like I said, a lot of times because the bladder sits right above it, people, because urinary urgency and frequency is also one of the effects that happen in menopause. You don't have a bladder infection, it's just that the hormones have changed. So it also helps bladder symptoms because it sits right above, so that area gets treated. We do more radio frequency because there's no downtime with that. So most of them, you do 3 treatments, and then you may do a maintenance treatment, like once a year or once every 6 months. And that's for most of the vaginal rejuvenation procedure. This is generally how it works. Okay? Because like I said, for us, we've even done people who weren't really having a whole lot of, I mean, it improves orgasms, because you can also do the outside. People have more clitoral orgasms than internal vaginal. So there is the O shot is another option that people will use. And that may help with, it helps to stimulate. So what's the O shot? So the O shot is we draw your blood, we spin it down, and we take the plasma, so the yellow part of the blood, we take that off and inject it into the top part of the vagina because there's an area that has more nerve sensations, and we also inject the clitoris. So it stimulates collagen production, nerve function, vascularity, and that's using your plasma, it's a stem cell.
You touched on it, but the question is, do you do rejuvenation here?
We do. I use BTL Excellis, which is radio frequency. So it's radio frequency and ultrasound. And it was my choice to use just because the risks are less. And there's no downtime with it. So if you wanted to go home that night and have intercourse. But they're, like I said, all of the different procedures, they're all basically doing similar things. They're just doing them in a different way.
So I have a question there. What's the difference between that and Mona Lisa?
Mona Lisa is a laser.
Oh.
And the BTL is radio frequency and ultrasound technology. And there's a couple other lasers on the market. There's a couple other radio frequencies on the market. It was just the one that, after doing my research, that just fit best for us. Questions? Y'all have that question? Yes.
So these treatments are elective,
Which treatment?
with the Mona Lisa and the radio frequency, those are elective.
It is considered cosmetic. So, yes, so the insurance will not cover. But, like I said, some people will use their health savings account. Or we have care credit, other places have care credit. So care credit is like a financing system, but you don't, for us, because of the one that we chose, you don't pay the interest. So long as you pay it off within 6 months, we cover the interest for it. And that's care credit. There's some other financing companies that we use. We use Cherry. I think that's
I just want to revisit the cortisol. So my PCP recommended cortisol for weight management. And so you're saying take it as a supplement? We need to increase it or we don't?
what's your level? Did they check your pump? Did they check the level?
Not at that time.
So here's what I tell you. Nothing is going to work for weight loss without a lifestyle. Even all the different medications, and we do them. All the medications that they have out, all the injections they have, if you don't change your lifestyle, it is going to, you will decrease it some, but it will come back. So the goal of all of this, especially with weight loss, is you have to have a lifestyle change and you have to be mentally focused. Like the biggest thing I tell people when they come in for weight loss is whatever is in your house that's not good for you, you have to take it out. Because if you don't, when you have those, when you have those cravings, you're gonna go eat. And I've had people tell me, but I have kids. And my thing with the kids is that you're gonna teach them to eat bad, so they can come see me too in about 10 years. If you're the person that's the main shopper, then you control all that. And so if it's not there, they can't eat, not at least in the house. They have to go work at it. And I tell patients, if you leave your house to go get something, then you should eat it. Because if you're making that kind of effort, life shouldn't be about you completely restricting yourself from anything that you enjoy. That's not what it's about. But it is about managing that. And so everything done in moderation is okay. So if you have to leave your house at midnight to go to McDonald's and get that burger, then you go get that burger. Because that's something, because if you keep depriving yourself, when you do get it, you're gonna overdo it. So I'd rather you do a smaller amount of it than. You missed my whole conversation about chicken. What was your question? No, that's okay.
So if you're trying to avoid estrogen, I want estrogen. So if I'm avoiding estrogen, I'm saying it's not right.
So are you okay with discussing what's going on with you?
Yeah.
Okay. So the question is if you're on an estrogen blocker, can you use hormones? So are you on an estrogen blocker because of a cancer?
Yeah, I first cancer survivor. So now I'm
Okay. Well, congratulations. Were your receptors negative? So I'm going to assume that they weren't because you're on an estrogen.
well,
Okay. So that's something we have to talk to you and your oncologist about. So there are people who have been breast cancer free and you've had a double mastectomy, so you don't have that particular risk in the breast. I probably wouldn't put you on estrogen. The question is, would they be comfortable putting you on testosterone? Because they're different hormones. And they have done, they're in the process of doing more studies for testosterone with people who are triple negative, so all the hormone levels are negative, in those patients who have breast cancer. So it's still kind of iffy for people who have had an estrogen positive receptor in regards to hormones. But for those patients, there are other things that people do in order to alleviate a lot of the symptoms. And somebody else, I thought somebody else had.
Question, I think, I feel like I'm still coming back.
It's okay.
To the, between the diet and the working out. So you know how you work out and you do crunches and stuff, and you still get like, and so is the majority of that having to do more with your diet than you're working out, or is it, you're still just trying to find out?
It's all of them. So sometimes, even though you are eating right, you are exercising, that little pocket just won't let go. And so there are different things that sometimes you have to do certain body sculpting procedures. If you've done everything else, if your hormones are in balance, if your diet is good, if you are exercising, and it's still not budging, then there's non-invasive, there's invasive. Non-invasive things would be like cool sculpting. It's not invasive, but it actually destroys fat cells. If you have a large amount that you need to remove, cool sculpting is not an ideal option because it's going to remove 20% of the fat cells. There is liposuction that people will do, and there are different liposuction devices. Some of them actually have lasers that actually tighten. We do liposuction, we do one that has a laser, so you're suctioning and laser. It helps tighten the skin, so you don't have a lot of laxity. So if you've done all those other things and you still can't get rid of it, then it's going to be a body sculpting procedure. Tummy tuck, liposuction, cool sculpting, there's some other procedures that you can do. Okay. Any further questions online? So, and I'll talk about myself. just my journey with the whole telething. Like I said, the reason for me was because it was the fogginess, and it was a huge issue for me. I thought my fatigue was just because I was doing a bunch of stuff. I'm working here, I'm working there, I'm up all night. So I thought that was a part of why I was tired. But once I got the pellets, my mood was better, and even my staff, they had it written on the calendar when I'm doing. Do what they tell me, go get my pellets. Life is better for everybody. I even implemented in for my staff that they get their pellets for free. Because I need everybody to be in a space where we not roll our eyes at the clients. So it is for us, it is our mental health. It actually makes us feel better. We like to laugh. We like to enjoy. And we want, when clients and patients come into the facility, that's what we want for you as well. But my journey was my libido got better, my husband is great. My energy was better, I was sleeping better, because I would be up 3 or 4 times just because, and when I wake up, I couldn't go back to sleep. And so a lot of people experience those things and they don't know what to do about it. And so like I said, I'm not saying you have to do pellets. There are other things that you can do, but you have to make sure you're with somebody who can address your concerns. I've had people come to me and say, well, why doesn't my gynecologist tell me about it? I am a medical doctor. I was trained as an MD. We are taught medicine. We are not taught a lot of alternative therapies. I think that's hopefully changing in the training now, but that's what we're taught. So don't be so harsh. You just weren't trained in that way. But you want to make sure that if you have these symptoms, that you find someone who can address your symptoms. And I've had people who, they don't do them, but they send them to us because we do. Just make sure whoever you're going to understands the whole hormonal thing. Because there are people who are doing it that don't quite know for sure exactly what to do. But so, which is why I'm telling you, so you're going to be your best advocate for yourself. If you have your uterus and they are giving you estrogen, you have to be on progesterone. You want to make sure they're checking your hormone levels and that they're just not giving you random amounts of testosterone. If you have symptoms, just knowing the different things that you can do to help with some of the side effects of the medication and what symptoms to look for. And once again, the symptoms that might bother you may not bother your neighbor. And so it might not be an issue for them. But if it's an issue for you, you have the right to live your best life. And so that's the goal of all of it. So mental health, fitness, your diet, your sleeping, your stress, all of those things are important and how we grow with this next part of our life. And so we're gonna make the best.
Did you say you could start the pellet during perimenopause, or do you have to wait?
If your levels are low, then yes, you can start it before. Just because you're still having your cycle doesn't mean your testosterone levels aren't low. When your estrogen levels drop below a certain number, that's when the cycles start. But your testosterone might be fine, and you're still getting a cycle, but you're miserable. So that's why I tell people, have your levels checked, so you know where you are and what you can do about it.
Having a cycle for like 10 more years.
Yes.
Experiencing all
Yes. I had a patient, she was in her 30s, and she had really bad anxiety, and she had tried the medication, and so we checked her hormones, and she was really low. And she did it for about a year, then started seeing a therapist, and started sleeping, and started changing some other things in her life, and came off the medicine. Once again, I'm not saying stop your antidepressant. I'm not saying to stop all your medication. I'm saying make sure there's not something else that's also causing. So just have your levels checked.
When we get our labs, what's the letters for the testosterone, so I can check, and my mom check?
What's the numbers or?
Well, like, what was it, actually, it says,
this.
doesn't say, okay.
And it says pre-testosterone, and it says.
There's free testosterone, there's total testosterone. We have a lab sheet, so we give you the lab sheet of what you need. But free testosterone, total testosterone, estradiol, FSA. There's 3 types of estrogen. So there's estrone, estradiol, and estriol. Estriol you'll see in menopausal women, higher. Estradiol is the one we want to know where you are. Okay, so free testosterone, total testosterone, estradiol, FSH. I always check the CBC. And if you have hatch cholesterol, I will check a cholesterol level as well. But as far as hormones go, those are the 3. So the total testosterone, the free testosterone, the estradiol, the FSH, and sometimes I'll do a thyroid.
If we come to you for a pellet, are you ordering the labs or are you doing?
As long as you don't have an HMO, we can draw the labs. And so we just tell you to call just to make an appointment, just so that she's not seeing 7 people don't show up at one time. But yes, we draw the labs. Usually take anywhere from 3 to 5 days to get the results.
I bet in the back, you guys want to schedule an appointment for your lab, she's ready. Yes. And we also have a couple of questions online. Would you mention again the cost of the pellet therapy, and also how often do you have to have your labs with pellet therapy?
So the first question is the cost. So for women, the cost is $400, and most women will get them every 3 months. I have some who get them every 4, and I have a couple who do once every 6 months. Everybody's different, but the average is usually every 3 months. For men, it is $800, and they usually get theirs every 6 months. As far as labs, so we draw your labs beforehand, and we draw your labs 5 weeks after the insertion. The reason we do that is because I want to make sure, number one, that your levels are in a good range, but we do a questionnaire as well. We don't just strictly go by your lab, we go by how you feel as well. So we do a questionnaire before, and we'll do one when you come back in 5 or 6 weeks. And if you have, like I said, if you don't want to get your labs done here, you don't have to. We can have you, we can give you the order to tell you which labs to be done.
Then how often do you do labs once you're doing pellets on a regular basis?
So once we've gotten your levels balanced, we do them for women once a year. We do them for men every 6 months. because they're getting such a much higher dose that we want to make sure like their platelets, because sometimes because of the high dose, the platelets can be high. So we usually check that, we check the CBC for men every time they come in every 6 months. Was that? Well, hopefully, we learned some questions that you may have been thinking about, was hopefully answered. I'm not saying you have to come to me. I'm just saying that there are options that people can do. And it's not all hormones. There are some other things that you can do if those certain things are bothering you. I've even put people on progesterone, and I don't do the synthetic progesterone. I do prometrium. So those doses are usually 100 milligrams or 200 milligrams. Those are the type of progesterone that you want to be. They're not synthetic, but you can get it from the pharmacy. So those are the ones that I tell people, and that also does help you with sleep. So that's another option that can help you with sleep. But people are talking about it all the time. Like the menopausal conversation has become more and more popular. I heard that Oprah's doing a show. I've seen it on The View. It's an issue. It's been an issue for a long time, but glad to know that we're talking about it so that at least you have the information. What you choose to do with it is completely up to you in your situation, but at least you know that there are options. You don't have to feel like that and live like that and have no other solutions. So that's the goal of all of this, is to give you the information. We are probably looking at doing another one maybe in June. It's a bigger one, but we'll actually have other people, like we'll have nutritionists there. We'll have a fitness person there. We'll have someone who does sex toys there. Because everybody doesn't have a partner who gets pellets, but your libido may significantly increase. So it is just making sure that we are addressing you and not just parts. Yes, ma'am.
So I have to tell you, ladies. And I know what the doctor was laughing because I just got the pellet 6 weeks. And I couldn't wait to come back to my appointment 2 days. That this has done wonders. I initially got because I had severe high. I was having high anywhere from 7 to 10 times. And they were, kind of go in cycles and phases, but initially that's why I was getting the and then once I got it, I knew that it could increase certain things for like the libido. Know that it had gotten so low until I got it, and I'm like, my husband's going to then also didn't like vaginal dryness. I didn't think that was an issue. I mean, like, I didn't think it was an issue. And I still don't think it was necessarily an issue, but I feel like in my 20s, 30s, didn't know that I was is that I struggle with fog. It's gotten better, not like the libido. So there were just these bonuses. I got it for one reason, all these extra bonuses. And I'm like, my body really needed that. I feel better. My mood is better. And I'm like, wow. But like I couldn't giggling like when the doctor said, she's like, you're smelling. So yeah, this palate, like I'm telling everybody, it's nothing else, get your levels changed. Like one of my girlfriends, she's like, wow, look at that. She's just like, she looked it up and she was like, how you did it? And I'm like, you feel nothing. Like, it took the doctor 5 minutes to do it, and it was like, okay, done, you know, go home. And then can't do it now, like, well, get your levels checked. If nothing else, because you feel like a different person. Like, I feel like a different person. Kind of like the doctor was saying, like, I would be in a meeting and just start sweating profusely, like, anxiety can bring on hot flashes. That's what I'm like. If I'm in a situation I'm uncomfortable, then I just shrink. So, yes, this has changed my life. Period. So, I'm
I've been on for over 3 years, and it absolutely changed my life. And I can tell sometimes, although when the new pellets came in, now that has changed a lot. She switched pellets. I used to be able to tell when it was time. Like, my sleep would go back to crappiness. It was just not good. And I was crabby, and, you know, the mood stuff came, and I'd be like, isn't it time? Isn't it time? And, or I'd kind of forget, and then my husband would be like, time to and I'm like, oh, yeah. And now, with this new one, it just holds way longer. Like, I would get my notice from the office saying it's time for like, oh, like, I wasn't really even aware. So I feel like it's way more even keeled now, but I was got this morning, so, yeah.
We just have a lot of different people walking around.
Yeah.
So I just have feedback, that is for anyone who's not, me, and also has been conversation and my anxiety.
So it's a real thing.
Recently heard about it, like literally within the last 2 months. I've never heard of it before. But I've heard, and I've heard since then horror stories, and I've heard success stories. But I heard about, I have a friend who has a patch, who has a couple people that have a patch. So, and they swear by the patch. I don't know if you talk
So the patch is estrogen. And so, once again, I still write prescriptions for estrogen. Whether it's the ring, whether it's the patch, whether it's the pill, I don't do the synthetic progesterone anymore. But I will write prescriptions for estrogen. There's nothing wrong with it. But for some people, that extra boost of the libido, of the fatigue, so some of those things are contributed to testosterone. But if you're doing well with the patch, there's nothing wrong with continuing to do that. And I'm not, like I said, I still write prescriptions for it. But pellets have been around since the 1930s. It's not new. And so in Europe, this is what they do on a regular basis. In California, in Texas, this is not new for them. Midwest, we're a little behind. So, but we're trying to catch up. There's all like I said, to talk about menopause. Because for so long, when you talk about menopause, it was always negative. It was like, oh, she's in menopause, she's this, she's that. Well, that's not the case anymore. There are things that can be done. So you still feel like you. And you don't feel like somebody has invaded your body. And you don't know who this person is anymore. So, we say marriages properly. And a lot of times, when the women come in, they go back and they talk to their spouse or their significant other because they're having issues too. They may not talk about it and they don't like to talk about it. But if it is something that helps their muscle mass, helps them not as tired, helps their erectile dysfunction, helps their overall general well-being, then that's something that they should know that they have an option to do. We do this, well, my husband does a male seminar, and they do it in gym, but it is just men. We don't go, I don't even go, I might go in the beginning just to, but I leave. And it's so that they can have an open and honest conversation about anything from heart disease to diabetes to fitness to hormones to erectile, they talk about all of it. And so it is just about us being more aware and more intentional on how we're living our lives.
So is it worth, because that's where I am about, like, going back to the husband thing. And he's seen what it's done for me, but he is one of those reluctant, God forbid I go to a doctor things. But is it worth running their levels if there's no, like, say, erectile issues? Because that's always the big thing, right? That they always want to check testosterone if you're having that. But if you're having some of the other stuff, because there's no problems there, but.
So by the time their levels get to, by the time they're having erectile dysfunction, their levels are like 200, 300. Heart disease starts at below 400 to 500. So it's not just about your erectile dysfunction. So if they're getting their PSA checked, they should get their testosterone levels checked. But a lot of physicians don't do it unless, so they're private.
Oh, right.
A lot of physicians don't automatically do it unless you're having some
Can't
type
even
of.
get there to do that. That's the problem.
So we're trying to get it overcome. And so, we have a lot of different things that are coming through. IEDs, it's not just medical, but we come in and they can just come and get their labs.
Yeah.
And then at least you know where you are. We even have a sheet that has a diagram that says at this level, this is what's happening to you. At this level, this is what's happening to you. At this level, this is the product. So we have a sheet that we can actually give to you. And you can
And they
take
can
it
just call and make an appointment to have labs done and go from there.
Yeah.
Perfect.
So I'm just beginning. Have you used it? Or if you don't have you used it?
Then you don't have to take progesterone. So the question with uterus and no uterus is more so dealing with if you're taking estrogen and you don't have a uterus, you don't have to be on progesterone. Some people are on it because it helps them sleep. But if you have a uterus and you are on estrogen, you have to be on progesterone because it'll cause overgrowth in the lining of your uterus and maybe those cells. Okay.
And then just quick question about the health and the insurance. So can we just call and ask the insurance, is it called testosterone pellet? Yes, just to keep it covered or not?
Yeah, so you can just do, so it's bioidentical hormones, but I would add specifically for pellet. Things.
What actually causes the hot flash? Why is there, I understand, electrical, what is?
So there are glands. And sometimes what happens is that when those glands, they sometimes get restricted and then sometimes they get extinct. And so a lot of times when that starts to happen and that's off balance, those hormones send signal to nerve functions. And that can cause, when they're off balance, you are releasing or dilating more and then the sweat starts to happen. And it's a way to, so sweating in general is a way to cool your body down. That's the reason why you sweat, a way to cool your body down. And so those sensories, they're detecting increase in thermal regulation. And so it's trying to cool it back down.
And I was going to ask you about, like when I go to the hospital, anywhere, I get so overwhelmed. Like, I would, there's something for, even for my brain, I can't do something, like a brain pill, like, that helps me think. But the vitamin D, like,
So so normal vitamin D levels are 30 to 100. That's the normal range. I have people around 50 or 60. If you're at 40, then you're right above normal. Most people, unless you are outside on a regular basis, are low in vitamin D.
2, 3.
So D2, so vitamin D2 is for people who are, they don't eat animal fat. D3 is if you don't have any restrictions in your diet, then you can do D3. D3 is better absorbed. But if you can't do animal products, then I tell people to do D2. When you are really, really low, below 30, especially if you're like 10 or 5, I will put people on 50,000 units per week, and I'll do it for 10 weeks. After that, your normal maintenance dose should be 20,000 D3 or D2 and K2. So they have them now where the K2 is what actually helps the vitamin D absorb better into your bones.
Yeah, I got so after you told me that.
So I don't like pills. So I get gummies.
Yeah.
Gummies may have a little bit more calories, but
It's not to make it count. But I do 3,000 a day.
yeah. So you have to look at the back of it because they're all different. Sometimes the serving size is 1, sometimes it's 3. It depends on which brand you get. But make sure you know how many you're supposed to take to get that amount of units. But 20,000 per week. D3, D2, and then ideally if they have K2. 50,000.
Oh, okay. So in the store, they sell the 20.
They sell 5 and 10,000. And so you can either do, like I have some people who do it once a day. I have some people who do it all on the same day. So long as you get it for the week. So I've had some people buy 10,000 unit capsules and do 2 of them, and they're done for the week. Yeah, you can do it all day.
Are you saying the 20,000 that like pretty much everybody needs that or get the blood level?
Ideally, so maintenance is usually I tell people 20,000.
Okay, that's main.
That's maintenance. If you're really low, the prescription is 50,000. Yeah. Was somebody here back up there?
So I heard you mention earlier that one of the things you said, so I've been synthetic for like 20 years. Is being on thyroid medication, does that have any different effect to menopause or?
Not being on the medication. If your thyroid levels are off, that can cause changes in your hormones. And that can cause regular bleeding, it can cause weight gain, it can cause problems with sleep, it can cause depression. So that's one of the reasons why some of those symptoms are similar to hormonal symptoms. And that's why I always check the thyroid. Because if your thyroid is off, it can cause medical issues.
There's another question. Do you prescribe DIM with pellet? Do you prescribe DIM with pellet?
So you don't have to have a prescription for them because it's a supplement. So you can get it at any health store. We will start carrying it just to make it easier for clients to not have to go and pick it up. But yes, I encourage either DIM that you can do, like I said, it decreases the side effects that can happen with testosterone.
What is it?
So it's a long name. It's diethyl. It's a really long but it actually helps. So when testosterone breaks down, it breaks down into different substances. And those substances is what actually causes the and so it combats with those supplements, with those substances broken down. So it combats that. So that's was a healthy discussion. And we probably see maybe 300 to 400 people who are on pellets or creams. It does change your life. And so everybody isn't always a candidate. The majority of the people are. And if there are things that you don't want to be on hormones, there are other things that you can do and that we can suggest. You just have to make sure you're talking to people who are open to listening to what your concerns are. And then we figure it out. Okay. But thank you, guys. And I'll be around for a little while. If you guys have questions, I know I've got this somewhere around. And so if you want labs drawn, we can get you an appointment set up for that if you want to do that. Or we can give you the sheet to tell you what labs.
Is that vitamin D as well, or just the pellet information?
I'll